Good morning, I'm Jonathan Athens with the Cocopah Public Relations Department.
I'm Michael Fila. I'm the emergency manager for the Cocopah Indian Tribe.
And we're coming to you live from the Cocopah Emergency Operations Center, or EOC. This is the fourth and last day of our participation in a nationwide exercise known as Crimson Contagion. In this live webcast, Mike and I are going to go ahead and talk about how the EOC functions. We're going to go into more detail about what this exercise entails, and we're also going to show and tell you about how real-time data is critical for emergency management, and that includes planning and training exercises such as this. Mike, you activated the EOC this morning. Tell us a little bit about the functions here and what's happening.
So to support the exercise, we've opened the EOC. We're fully activated right now. For the last couple of days, we've been on a virtual EOC, which means we've been just monitoring the systems and talking to each other and making sure that we have that information flow of what's happening. But today we're going to be opening a pod tomorrow. We're simulating. Remember, this is an exercise. And what we're doing is we're going to brainstorm on how that pod should look, and we need the EOC to open to support that pod.
In addition to Mike and I, there are 9 people in this room. Each one are manning a station. Each one has a critical role. It's called an essential support function. That is operations chief, logistics, law enforcement, communications, transportation. We're going to go more details on that a little bit later, and we'll have another webcast talking about that. But right now, let's discuss the details of Crimson Contagion. The scenario plays out as such. A group of international travelers in China were infected with a flu virus. They then got on flights back to their home countries, and that's where the spread started with this exercise. Mike, talk a little bit about that.
Yeah, so what we had was 35 travelers come back from China. They came back into the United States, went to their home places, and what happened was we started having a flu outbreak here, and it's turned into a pandemic. And this is on June 12th this all started.
And the way this is playing out, Arizona is among 12 states that are participating in this nationwide exercise. Again, this starts with the federal government all the way down to the state and local level. Cocopah Emergency Management, the Cocopah Tribe, is one of the players in this exercise in Arizona. And as Mike was mentioning, the key here is that this exercise replicates a pandemic, the spread of a virus, and to show you the different levels of severity and where this ranks according to history, we have this chart right here. It shows the range from low severity, moderate, high, very high. The scenario that we're playing out right now, Crimson Contagion, ranks right here alongside the 1918 pandemic. Mike, talk a little bit about that.
So the 1918 pandemic, if nobody's aware, 500 million people were infected, and between 20 and 50 million people died. And they really say that 5% of the world's population died from that pandemic.
And the reason that the planners and organizers chose a very high severity is because they wanted to test our preparedness, everyone, on the federal, state, and local level. How prepared are we in terms of getting vaccines out in order to diagnose and treat people? You had a pandemic 2014, one in 2009, another one in 2011. Much lower scenarios, but again, they wanted to test to the highest level, and that's why they tested on the same level as what happened for real in 1918. Now let's take a look at the timeline. Even though this exercise started on August 13th and it's concluding today, that's where the real gameplay comes into play here. The timeline, the way this was written, is it went all the way back to June 12th when 35 tourists got sick, and then the H7N9 was identified on June 26th. That's the virus they're talking about. What you're seeing here are the national event timelines, and then the timeline for Arizona events follows along here. And that's where we get into another critical aspect, which is real-time reporting. We're playing this scenario, and the time right now is 9:28 Mountain Standard Time.
Yeah, and here in Arizona, there's 15 counties and there's 13 tribes participating in this exercise, along with the state. And what we're doing is we're testing communications, we're testing policy decisions, we're testing our plans, and making sure that we find those gaps now under blue skies before we have to really use the plan in a real-life emergency.
And in real life, everything's happening obviously in real time. And so in this simulation, we have to follow that same pattern, getting data in real time, even though it's just an exercise. So here's an example of that. This is the website that the health department put together for this exercise. AZ, Crimson, Contagion. This is what we're using. Everyone in the EOC is using this as their stage to move forward with the exercise. The next panel
And what we do is we have a good timeline
Yeah.
here. We have media. What's the media saying nationwide, worldwide too, epidemiological data, and we have other resources here. So this is a great website for us to get information from, and we're going to show you some of the more, because we can't make really good choices if we don't have really good information. So this is an information center, and what we do is we take that information and we make the best choices for the community.
And the website that we use in case of a real emergency is Web EOC, and we're going to pull that up right now. And as you can see with this one, this is the log, and this shows you the latest information across Arizona as it's happening. This also shows you the exercise. But this is how the information comes to us. It comes one installment at a time, with the date, with the time, contact person, phone number, and where it came from. This one came from the Department of Emergency and Military Affairs.
Yeah, and what we do is if we need to order resources, we would order it through this website, and this would be a tracking tool for us.
So if looking for real-time information, if this contagion was happening for real, we would want to know the availability of the hospitals. Are they active? Are they open? Do they have beds available? What about life flights? Here's another example of that.
So this is EM Resource. This is a tool that the state has given all the counties and the tribes that want it. And what we do is we monitor. We can't make good decisions without knowing what's happening out there. So this tells us if there's any of the hospitals are experiencing any problems, and if we have air flights that are down, medical transport. So we all our decisions are based on the information that we get, and we need up-to-date information, and these systems help us make those decisions.
So you see here, these are all the hospitals in the area. Right now, the Yuma Regional Medical Center, last update was at 0728 hours. That's an example of how real-time reporting comes to us and how we're able to use that information to address these calamities, these crises that happen.
Yep. And we got one more screen we want to show you. This one here is just the flight patterns that happen around the world as of this morning. And just think about, little food for thought is in 1918, we had that much, 500 million people were infected by this flu. And think about the mode of transportation. And now think about 2019 in the mode of transportation. So it could happen, and it could happen very fast. And we want to be able to mitigate some of that problem before it happens. And that's why we're here today.
And make sure to stay with us in a couple hours. We'll have another update as this exercise comes to its conclusion, and we'll show you more about the Emergency Operations Center and some of the folks who work in critical positions and how they do their job. Stay with us.